Hello, welcome to Medical Dialogues. I'm Roshni. Let's look at today's top news. Regarding the NEET counselling, MCC releases provisional result of stray vacancy round. The MCC has released the preliminary results for the stray vacancy round of NEET UG 2023 counselling. These results encompass important details like rank, allotted quota, allotted institute, course, allotted category, candidate category, and remarks. A total of 2,140 candidates have had their provisional results declared. To access the result, you can click on the link provided in the description box below. Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below. Ex-IAF contracts HIV during blood transfusion. Supreme Court directs Indian Army Air Force to pay Rs 1.5 crore as compensation. While considering the case of retired air veteran who contracted HIV during a blood transfusion while falling sick on duty during Operation Parakram, the Supreme Court bench on Tuesday held the Indian Air Force and the Indian Army jointly and vicariously liable for medical negligence and directed them to pay Rs 1.5 crore as compensation. The appellant is entitled to compensation calculated at Rs 1 crore 54 lakh 73,000 only towards compensation on account of medical negligence of the respondents who are held liable for the injury suffered by the appellant. It is also held that since individual liability cannot be assigned, the respondent organizations are held vicariously liable jointly and severally to the above extent. The amount shall be paid to the appellant within 6 weeks by the IAF. His employer, it is open to the IAF to seek reimbursement to the extent of half the sum from the Indian Army. All errors related to disability pension too shall be disbursed to the appellant within the said 6 weeks period, ordered the top court bench comprising Justices S. Ravindra Bhatt and Justice Dipankar Datta. Apart from this, in keeping with the mandate of the HIV Act, the Supreme Court also issued certain directions to the central and state governments asking them to take measures giving priority to people suffering from AIDS. Doctors at Moga Hospital remove earphones, screws, bolts from 40-year-old patient's stomach. In society, there are unfortunate instances where individuals engage in alarming activities without much concern, sometimes even endangering their own lives. In a recent incident that occurred in Moga, Punjab, a 40-year-old man who reportedly suffered from a mental illness underwent a medical procedure to have unusual objects removed from his stomach. The incident was brought to public attention through a post on social media by a page called Punjab News TV. According to the video, the patient had been experiencing severe and persistent stomach pain, prompting him to seek medical help at Moga Medicity Hospital in Punjab. A team of skilled medical professionals conducted a 3-hour surgery during which they extracted a variety of items from the man's stomach. These items, as you can see, included earphones, lockets, screws, and rakis, among other things. According to media reports, the director of Moga Medicity Hospital explained that the patient had been suffering from stomach pain for a period of 2 years and was admitted to the hospital due to additional symptoms like fever and vomiting. The medical experts diagnosed the patient with pica disorder, which is an eating disorder characterized by the consumption of non-food items.
कल मोगा मेडिसिटी हस्पताल ਦੇ ਵਿੱਚ ਪੇਟ ਦਰਦ ਦੀ ਕੰਪਲੇਨ ਨਾਲ ਐਡਮਿਟ ਕੀਤੇ ਗਏ। ਜਦੋਂ ਇਵੈਲੂਏਸ਼ਨ ਕੀਤੀ ਗਈ ਤੇ ਪਤਾ ਚੱਲਿਆ ਕਿ ਉਹਨਾਂ ਦੀ ਪੇਟ ਦੀਆਂ ਆਂਤੜੀਆਂ ਬਲੌਕ ਸੀਗੀਆਂ ਤੇ ਪੇਟ ਵਿੱਚ ਕਾਫੀ ਵੱਖਰੀ ਮੈਟੈਲਿਕ ਪਦਾਰਥ ਉਹਨਾਂ ਦੇ ਫਸੇ ਹੋਏ ਸਨ।
Due to the ingestion of sharp objects, the patient had several stomach wounds. While the surgery was performed successfully, the patient remains on a ventilator and is in critical condition, as stated by Dr. Ajmer Singh. Will Supreme Court's intervention finally solve the stipend disparity of MBBS interns? Doctors hopeful for verdict. Despite numerous protests and representations to the authorities, non-payment of stipend or disparity regarding the amount of stipend paid to the MBBS interns across the country remains one of the unsolved issues even today. However, Supreme Court bench recently took cognizance of the matter. Now the doctors are hopeful that the issue might finally get resolved and the intern doctors will get adequately paid for their hard work. While considering a plea filed by the MBBS students of the ACMS, recently the Supreme Court, the NMC's response to the claim alleging that 70% of medical colleges do not get paid any stipend or are paying the minimum stipend to doctors who are doing their MBBS internship. Taking cognizance of the issue, the top court bench led by Chief Justice of India D.Y. Chandrachud directed the NMC to file a report giving the details about the claim and also directed the Commission to inform what steps have been taken to ensure payment of stipend to them as per the NMC norms. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.